the circumstances under which hysterectomy is done? A hysterectomy is a surgery in which the uterus is removed through a surgical intervention. So this can be done either through an abdominal method, it can be done vaginal method, or it can also be done through the assistance of a laparoscopy or endoscopic procedure, what is known as the keyhole surgery. So hysterectomy may be done for various causes, and it is seen that it is not a frivolous procedure. Generally, it is a major surgery and it has to be done with adequate planning and care in a reputed hospital and under the aegis of a reputed surgeon. So what are the circumstances that may necessitate a hysterectomy? So we usually advise hysterectomy to a person only when medical treatment fails. So a hysterectomy may be needed especially when the person is suffering from bleeding disorders. Here obviously we try a couple of hormonal treatments, we try even DNC, and if this fails, only then do we subject the woman to a hysterectomy. Some of the commonest causes for a hysterectomy may be the presence of lumps in the uterus, which may be in the form of fibroids or adenomyosis. A hysterectomy may also be needed in some patients when there is prolapse of the uterus, that is, the uterus and cervix have come down through the vagina, have slid down the vagina and are present at the vulval region. So this is known as descent of the uterus. So they may present as some kind of swelling in the vulval region, but they are actually the uterus which has slid down along with the adjoining structures. So this may definitely require a surgery that may need the removal of the uterus. Apart from that, infections of the pelvis, what is known as pelvic inflammatory disease, when acute, when chronic, can cause different changes in the structure of the uterus and the surrounding organs. So this may again lead to a hysterectomy. And a hysterectomy may be needed, of course, if the person has been diagnosed with cancers of the reproductive tract. So these cancers may be involving the uterus, the cervix, the surrounding fallopian tubes or the ovaries, and obviously this may require removal of the uterus. So as far as hysterectomy is concerned, it is important that we do it if there is an underlying cause, and obviously it has its own advantages as it can provide relief and it can also cure the patient of whatever illness the patient is suffering from. Thank you.